Ni hao. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much. My name is Surotul Ilmiyah. You can call me Ilmi. Today I'd like to present my research in International Brain and Biomedicine Conference in Pakistan. My research is about hamilton. Thank you very much. This is the new mobile apps as a mobile health solution to prevent stunting birth among risky pregnant women in Indonesia. I'd like to present my study protocol for community-based randomized control trial in urban and rural area in Indonesia. I'm from Central South University, Changsha, China. Okay, first, I'd like to give you some information about stunting. What is stunting? Stunting is defined as a failure of development in children due to chronic malnutrition. It's a cure at birth due to factors affect the fetal growth, and development is manifest by low health for age, and it shows in Z-score, usually below -2 standard deviation. This is called stunted baby. And also below under 3 standard deviation, it means severely stunted. This definition is from WHO. And stunting also showing restriction of a child potential growth. Stunting, it happened in the first 1,000 days after conception. The indirect impact of stunting are increased morbidity, low intellect quotient or IQ, and also metabolic development impairment. And it has impact on cardiovascular disease and poor human resources. It can make delay of schooling and also low IQ for the children and low productivity in adult. As we saw in this picture, stunting baby or stunting children usually they grow so softly, and it makes the body become short. The background of the study is Indonesia is the third country which is highest stunting prevalence in Southeast Asia. This data belongs to WHO 2020. Indonesia target the stunting prevalence to fall by 14% in 2024. And from the prevalence, around 23% from 31% stunting cases in Indonesia were observed from the birth. It means pregnancy is the main entry point for stunting. As we know, stunting has a burden in the world. The number of deaths from stunting in the world exceed 164,000 in 2019. It belongs to GPD. A national cost of stunting was estimated under USAID around 508 million, World Bank said in 2021. Stunting accounts for 300 of disability adjusted life year or daily among children under 5 in 2019. And also stunting globally is the 4th level of risk. Pregnant women with anemia and chronic energy deficiency or we call it CED or CAC, having stunted baby. It means how we prevent during pregnancy period is the most important period. And as you know, in Indonesia, the prevalence of anemia is around 44.2%. And also CED is 17.3%. It belongs to Riskus Das from Ministry of Health Indonesia, 2018. Existing intervention now is traditional education, and Indonesia use KIA book, which is maternal and children book, to improve pregnant women. Rely on, as we know, the manual intervention take a lot of manpower, and also if it's assessed by cadre have low knowledge, understanding of stunting, and it needs knowledge update. If we only make sure for monitoring and education using KIA book, so many pregnant women has low compliance to take nutritional in. It's not easy to conduct antenatal care, and the chance of easy loss to follow up is high. And also the book needs more printing method. As we know, the globally mobile health apps reach so fast. Internet user is reach higher. And now mobile health is used for behavior change communication to improve the health. Mobile health can have some advantage to give health education for stunting prevention, and how we can assess a different level of stunting risk. And then we can provide the proper nutrition and healthy practice information. We can send a regular reminder, facilitate remote consultant, and also we can connect it with healthcare provider and also cadre and the community pregnant women. It can help pregnant women to track the nutritional intake, weight gain, and even create online communities to access emotional support. It's really needed in Indonesia. And also mobile health apps can reach more pregnant women. Even if they don't have KIA book, they can still use these apps. No mobile health has conduct for pregnant women to prevent stunting in Indonesia. So the current unsolved scientific issues for stunting birth prevention among pregnant women based on mobile health technology is first, existing research has limited for long-term evaluation of international effect, such as incidence stunting at birth and other behavior indicator of pregnant women. Only India has conducted stunting apps. It's called M-Sahi for reduce malnutrition and also to control prevalence for stunting. But for in Indonesia, no apps has calculated for long-term evaluation for stunting prevalence. This research is the first randomized control trial for control the long-term effect of incident stunting. The second one is the education content and monitoring system in KIA book or maternal book is still manual. The content, interaction, and function should be improved to increase the compliance to take antenatal care, nutrition intervention, and also it needs cost-effective for developing the new app, and then it can use easily for pregnant women. The third is our mHealth app will include a broad spectrum of intervention ranging from education, monitoring of supplementation, nutrition intake, and also even giving reminder for pregnant women to follow the antenatal care program and also the government program. The last is it needs for conducting in rural area, so it can make equal on health service. So the research question is first, how to develop a design of mobile health apps intervention program to prevent stunting at birth since pregnancy. Second one, after the mHealth intervention design, will it better meet the needs of the user and improve the app usage satisfaction to reduce loss to follow-up of research participants? So how is the feasibility satisfaction evaluation of mHealth stunting prevention at birth in trial program? And the third is, how is the evaluation effect of mHealth apps in improving the compliance of taking pregnancy behavior practice? Because it's behavior change program. And the last is, can the 6 months app intervention of study with improved design of mHealth reduce incidence of stunting birth among pregnant women in Indonesia? So study will conduct in pregnant women since the second trimester until the delivery. The objective is first design. I want to develop the design of mobile apps intervention program to prevent stunting birth since pregnancy. And the second one is the feasibility, to evaluate the feasibility or usage satisfaction and prevent loss to follow-up. And the third one is behavior change, to evaluate the effect of mHealth for behavior practice. And the last one is stunting incident. I want to evaluate effect of mHealth for 6-month intervention in pregnant women to reduce incidence of stunting at birth. This is the logical model of the problem. I use mHealth intervention theory and also proceed model that conduct the personal determinant. We address some personal determinant that cause stunting. First, low maternal health and nutrition condition, and lack of knowledge and awareness about stunting, lack skill to create recommended nutrition in early marriage, and also early marriage. Personal determinant is for environment background is low economic to access unfree facility, low access to rich healthcare, lack of technology support, and limited access for manual KIA book, lack of pregnancy forum, lack of intervention monitoring, less intervention focused on stunting for pregnancy, less health education from medicine about what care is needed for pregnant women, and limited cadre knowledge, and also posyandu didn't operating well for pregnant women. The third phase is behavior at risk group and environmental factor. First, lack of dietary diversity intake, lack of iron and folic acid consumption, and also lack intake of animal protein, because animal protein is giving power intervention for reaching the growth to prevent stunting. And also lack of consuming prenatal lipid-based nutrient supplement, lack of completely 6 times antenatal care practice, and less participation in pregnant women class. For environment, usually cadre didn't provide information about prevent stunting. They only conduct the usual prevention. And also lack of information system monitoring since pregnancy. Book is not enough to monitor the prevention process. Less information pregnant women about women class, and different program and facility for public and private healthcare. Usually public healthcare, some place is free, but some place is not free. But for private clinic, usually they provide not free. And how I will take a look for health problem. This is the cause of disease that lead to health problem. It will decrease maternal body weight, decrease maternal body mass index, and also it makes lower upper arm circumference that make it chronic energy deficiency and maternal anemia and limited micronutrient or micronutrient deficiencies such as iron, zinc, folic, and etc. That will cause stunting at birth. So this is the flow chart of logical model of the problem of stunting. For the randomized control trial, I follow intention to treat. This protocol paper describes cluster randomized control trial that healthcare or health clinic is the cluster. I will create Hamilton. We call it Hamilton. Why Hamilton? Ha is my prof who, and me is my name. And Hamilton, Hamil in Indonesia, it means pregnancy. And ting stand. Hamil stunting. Use around 8 until 14% the stunting birth incident of risky pregnant women in intervention as compared with the control. The secondary objective include evaluating impact on antenatal care, dietary diversity, birth weight, infant development, and also the outcome of pregnant women behavior. Total, there are 1,044 participants or pregnant women divided into two groups, control and also the intervention group. I will take some assistance from the cadre. There are 40 cadres and also the trained counselor from 40 healthcare or health clinic. And this is the randomized control trial process. First, I will conduct intervention in West Java province in Indonesia. It has around 27 districts. It's divided into 18 rural and 9 urban. Why West Java? Because West Java is the first highest stunting case in Indonesia. And I will divide it into two groups, 2 rural district and also 2 urban district. It's in rural in Cirebon, Kabupaten Cirebon and Kota Cirebon, and for urban in Depok and Bekasi. This 40 eligible health clinic, I will provide 10 of each district as the group randomization. And for allocation, I will allocate pregnant women in 40 health center, since one health center usually provide 30 pregnant women. So I will need around 40 health center. And this is for intervention. The intervention is using mHealth apps with usual antenatal care program. And for control, they don't use mHealth app. They only use a usual antenatal care program that it's using KIA book. So it's balanced between pregnant women, and I will conduct baseline research for the pregnant women, and then they will be given intervention, and I will follow up each 3 months and follow up again when 3rd semester until the stunting newborn or delivery process. Let's see how many people lost to follow up. And this is the process for the apps Hamilton. First, pregnant women, they will be given mobile apps, and then they can download the mobile apps, and then they can fill the form, and I will spread into 2 groups by using screening risks. Some people that has highest than median, so it's called high risk group. For some pregnant women that stay in under median of the risk, so it will enter to low risk group. And it will different between low risk and high risk group. Low risk will receive frequent notif every schedule. That means only when antenatal care, so maybe 1 month, 1 month, once a month. But for high risk group, they will not get notification almost every week and every the schedule of antenatal care. And this group will be provide health information, healthy behavior recommendation, and they will give they will get notification what intervention or what behavior or what nutrition that it's good for preventing stunting. And then they also will be connected to healthcare to take antenatal care. And they can take nutrition or medicine through the healthcare or through Posyandu. We call Posyandu for Community Healthcare Integrated Program. And they can also call the doctor, midwife. So people that are living in rural, that no midwife or no doctor, they can easily to talk with the doctor. And also, we connect with peer forum in the community. With peer forum, they will show in each Posyandu and the same pregnant women in the living process in the same district or in the same healthcare, and also assisted by cadre. After that, we can look the individual prevention, how they follow the guideline, and how they keep in touch, and how they follow the recommendation until the behavior will be changed. They will conduct self-assessment each trimester and delivery the baby. We hope a healthy baby without stunting. Okay, thank you very much. That's all my presentation. Thank you very much. I hope you can understand what I'm saying. Thank you very much for watching, and see you, Pakistani. Greeting from Indonesia and also greeting from China. I'm Surotul Ilmiyah from Indonesia that now join PhD program of public health, especially epidemiology in Central South University, Changsha, China. Will be nice to meet you in oral presentation online. Thank you very much. Wallahul muwaffiq ila aqwamit thoriq. Wassalamualaikum warahmatullahi wabarakatuh. Thank you very much. Bye-bye.